Hello everyone, welcome to our channel today. Today we're going to discuss one very common disease, furrowed shoulder. Furrowed shoulder is also called adhesive chondritis. It is one of the most common disorder in shoulder joints. So the main symptoms of furrowed shoulder, the patient will tell you the first one is the pain. The pain in the shoulder area. And also, the pain can develop worse and worse. The patient will lose the normal range of the movement of our shoulder joints. This symptom can begin gradually, and the symptoms tend to be worse if it's not treated. The process may begin with an injury, or may not with the injury. The patient may have the history of being injured or may not. Sometimes the patient just will tell you this happens all of a sudden, and in Western medicine it is thought to be some inflammation in the shoulder joints. I still remember there's one case we saw in 2015. In 2015, I was lecturing at University of Western Cape in Cape Town. There's one afternoon, we saw one lady, one Muslim lady. She got severe furrowed shoulder. After the treatment, about 30 minutes, she bursted into tears. She said to me, "It is a miracle." So how did it happen and what happened at that time? Actually, because the patient, she got a severe furrowed shoulder. She had been to the doctors, been to physios for all these years. She didn't see that much improvements. Her arm couldn't open more than this. That's all what she can do. She couldn't bend, she couldn't comb the hair. And after the treatment, her arm can lift up to this level immediately. That's why she bursted into tears and told us it is a miracle. How did all this happen in 30 minutes? The cause in Chinese medicine for furrowed shoulder is due to cold and wind. Why do we say that the cause of the furrowed shoulder is due to the cold condition? It's actually because the patient will feel worse with low temperature. So like in winter, the patient will feel worse, the patient will feel more pain, and also the patient sometimes will feel less movement. The typical symptoms of furrowed shoulder, the patient will tell you that they couldn't lift their arm on the side. In the front, they couldn't lift up as well. And also the patient, most of the patient will tell you they can't comb their hair because they couldn't lift up the shoulder. And the other typical symptom is the patient can't bend their arm to the back, so they couldn't do this. The hand couldn't move to the back. So these are the typical symptoms of furrowed shoulder. And in Chinese medicine, we can use acupuncture and herbal medicine to help the furrowed shoulder. The herbal medicine we use is, you can use the herbs to clear the phlegm, also to warm the body up. One of the formula can be used is 紫米茯苓丸. Obviously, we're going to modify it according to the patient's condition. For the recovery of furrowed shoulder, the treatments with herbal medicine and acupuncture is very important. At the meantime, the exercise also is very important. So the patient is recommended to stretch the shoulder. The more, the better. For acupuncture treatments, sometimes we use through-in needle. The method of through-in needle So the points we choose for the most typical furrow shoulder, we can use stomach 38 through bladder 57. So let's see where's the stomach 38. This from the model. That's here. The point is some stomach 34, 8 cun below stomach 34. Still on stomach meridian 8 below. So it's almost halfway between the ankle and the back of your knee, almost in halfway. So normally what I do is I will use a 3 needle. 3 is about 75 millimeter needle. It goes all the way from stomach 34 to bladder 57. And as the needle goes in, I will manipulate with the needle with our fingers, and at the meantime, I will ask the patient to move their shoulder, especially to move the range of the shoulder, especially to the direction where the patient can feel pain. We're also going to leave the needle for 30 minutes. For most conditions, the patient actually can feel relief after the treatment. As you can see from these pictures, these cases are the cases from our clinic. We choose some of the case we took the picture. As you can see on the left side, the picture was taken before the treatment, and the photos on the right side were taken after the first acupuncture treatment. We have chosen 4 cases to show as an example here. This case, the patient suffered from the pain from a few months to a few years. All of them we can see the significant improvements after 1 session of acupuncture treatment, which is after about 30 minutes of the treatment. So actually, acupuncture treatment is very effective in this condition, and the patient is recommended to accept the herbal medicine and acupuncture treatment. The sooner the better. And at the meantime, after our treatment applied, the patient still need to keep warm in the shoulder region. Also need to do the stretching exercise. They can put their arm against a wall and link their body to the wall. So it's very similar to this. The patient can link their arm to the wall and the body is linked to the wall. They keep stretching. Actually, the stretching is the patient can do the stretching as much as they can. It can help you to open the joints to improve the movement. Thank you for watching our video today. For more information, you can visit our website.